if you feel that you have a story to tell, that you have a way, you're not sure about resources, talk about it.
What is working well for our community, our children, our family with mental illness? What is not working? What can we do as a community to collaborate to make it work?
What has to happen is us, the collective.
We know that as long as we keep the dialogue going, we can help people get their lives back.
I have a story to tell. I hope it will inspire you and show you that though the road to the process of recovery is sometimes difficult, it is indeed possible.
I got into the military and went through the things that I went through and came home from the Far East. I was wrecked. I became afraid. And I got caught up in the substance abuse while I was there. And I came home and to my wife and my children. I couldn't talk. I was 28 years old. First time I went to jail. I was stigmatized. Nobody in my family had ever been in prison. I just couldn't talk about things that was happening in my life.
I had an uncle that 50 years ago had these bizarre behaviors that we never understood. He would go for 6 months totally depressed, never coming out of his room, couldn't hold a job, and then all of a sudden, 2 weeks later, he had this incredible high. He was engaging with people. He was shopping like an alcoholic, buying everything he could see. And we didn't realize at that time that he was a manic depressive. And he went for years with an undiagnosed mental health problem.
That boy ain't well. Now, for those of you who never spent time down south, let me interpret that for you. That boy ain't well means, now listen, that boy ain't well.
That's right, we know this.
I'm gonna go down and talk to that boy's mama. We gonna help that poor creature. But that boy ain't well meant that this spoke to a global condition of this young man. Mm-hmm. It also did not speak to mental illness. The only way that you know that there was a mental illness there is if you press, so how is this person sick? Because it wasn't about singling anybody out. It wasn't about making them feel different or less than. The idea was, how do we help this person? Person first.
It's really important that we engage entire communities in understanding how important mental health is to our communities, not just individuals that they may see on the street or they see depicted in movies. Because the reality is that every one of us knows somebody or has someone in our family that's struggling with mental health issues. 1 in 5 individuals struggles with some sort of health condition, and we want to have healthy communities. And having communities that have good mental health is just as important to having communities that have economic health and physical health.
A good number of people out there have a diagnosable mental illness and often are treated for it and are able to re-enter everyday life if they ever had to leave it. And I think those stories are really, really important for people to hear. The fact that regular, everyday folks, have these experiences, know these folks, I think makes a huge difference in our understanding of it. And again, I think it just makes it possible for more and more people to maybe seek help.
When I first started hearing about, the whole peer movement and people openly talking about, oh yes, I've been to a locked facility and stuff like that, it made, my experience not seem bad, just kind of what it was, an experience along my journey.
Well, it is about, breaking the silence on mental illness. 40 years ago, my brother actually committed suicide a day before his 21st birthday. 40 years later, I attended the White House Conference on Mental Health, and there actually President Obama said, and I quote, there should be no shame in discussing or seeking help for treatable illnesses that affect too many people that we love.
Oh yeah, I mean, what I think it really comes down to is stigma. And I think part of stigma is not wanting to tell people about your mental illness, partially because I think you're stigmatizing yourself. You're really thinking that there's something wrong with you, so you don't want to tell people. But the more people know, and the more it is kind of normal for people to have a mental illness and to know what it is, then it's just going to make it so much easier for people to, I guess, for lack of a better word, come out as mentally ill. And I think that is something that just needs to keep happening. And the recovery movement is great because it centers around just people with mental health issues getting better and having lives that they feel good about and feel comfortable with.
Well, it's important because, even from my own personal experiences, having lost my son a little over 3 years ago to mental illness and having been diagnosed with bipolar depression. And it's a matter of talking about it because I want people to recognize that mental illness is an illness, not unlike heart disease or diabetes or any of the others. And for some reason, there's a stigma that's attached and people are reluctant to talk about it. But as I usually give for my own metaphor, I say, if I were to fall on the ground, one would immediately gather around and try to call 911 and try to get me assistance. But in the same token, if I was to start running around, start tearing up all my clothes and start running around the office, then the response is not calling 911 to get me assistance, they're calling 911 to call the police department in order to deal with it. So we have to change the paradigm of the way people think. We have to have them think of mental illness as an illness. And that's why I'm involved, largely because of having lost my son, but even prior to that, because of my engagement with community health centers, it is to be able to educate people that it's all right to talk about mental illness.
Understanding myself allows me to express it. So instead of fighting with people about my diagnosis, I explain it, and then I say, this is what I need from you, and what do you need from me to make this work? Because it's not normal to be in conflict all the time. So if you can openly say, I need this from you, what do you need from me? Let's work this out.
Yeah, and taking that first step of saying, oh, this is what I need from you, helped me build confidence to say, right now I'm experiencing a little bit of anxiety.
Right.
And kind of taking that next step to feeling comfortable talking about, I have anxiety.
Right.
And, openly with another person. And even allowing them to say, what is anxiety, or I don't understand, being open to that question and being able to answer it and not being afraid of being judged because, you're just asking to get your needs met.
And the simple fact that a person can recover from mental health disorders and mental illness in general. And most people don't really understand that. And I think it's very important to at least have an opportunity to mention that or make it clear that there's a life past being in a hospital or having a diagnosed illness and having to take medications and things like that.
I would say you're not the only one, and I would say you're not crazy. And I would say this is not the way to deal with it. There are better ways. There are people, there are resources, and be open with yourself and be open with the people who are there to support you, because this is not the way to be healthy and happy, and you deserve that.
Take this power, take this information, and take it back to the people that need this information to change and transform their lives for the better. Any questions are fair. Everything that you take away from this conference today is fair. And don't just do it today, but let's keep this conversation going.